Hello, my name is James Ledbetter. We are Group 1, and we are going to be covering the Canadian healthcare system. For our introduction, Canada is known for their universal health coverage that is funded through a health system called Medicare. The Canadian Health Act was created to establish and uphold the 5 pillars to construct a healthcare system. The pillars were that the system must be universal, publicly administered, have comprehensive coverage, portable across provinces, and accessible to the population. This Medicare system covers 100% of the population and manages all of its own residents with their specific residency requirements. The Canadian healthcare system provides excellent access to healthcare and has low rates of health disparities throughout the whole country. Who is insured? Canada has a national health insurance program that is a government-run health insurance system covering the entire population for a well-defined medical benefits package. This is called Medicare. This health insurance package is universal, and with little exceptions, the health coverage is available to all residents with no out-of-pocket charges. Patients in Canada do not participate in the reimbursement process, considering this exclusively takes place between the government and the healthcare provider. Services delivered are not-for-profit, with each public authority being accountable to the local province or territory. For the United States, the US healthcare system does not provide universal coverage and is explained as a mixed system. Publicly financed government, Medicare and Medicaid health coverage coexist with privately financed market coverage. Out-of-pocket payments and market provision of coverage is used as a means of financing and providing healthcare. Through one of our journal articles, an excerpt as of 2019, around 50% of citizens received private insurance coverage through their employer, group insurance. 6% received private insurance through health insurance marketplaces, non-group insurance. 20% of citizens relied on Medicaid, 14% on Medicare, and 1% on other public forms of insurance, Veterans Health Administration, and Military Health Service, leaving 9% of Americans uninsured.
Hi, my name is Tiffany, and I'm going over whether or not insurance in Canada is compulsory. So compulsory means whether or not it's required by law. So it's any insurance that citizens are required to buy, such as auto insurance. However, that is not the case for health insurance in Canada. They have universal coverage, so anyone can apply for insurance. However, it's not required. They're not penalized or taxed if they do not obtain insurance. I know in some circumstances, insurance is required for some people, such as international students. And after 3 months of residency in Canada, you're eligible to apply for health insurance.
Hi, my name is Damilola. I'm going to be talking about who pays, starting with Canada. Canada has a universal healthcare system called Canadian Medicare, funded through taxes. Healthcare is funded and administered primarily by the country's 13 provinces and territories. This means that any Canadian citizen or permanent resident can apply for public health insurance, and each province and territory has different healthcare plan that covers different services and products. There are also some important differences between each plan. Also, each province and territory receive cash assistance from the federal government on a per capita basis. In general, Canadians with public health insurance won't have to pay for most healthcare services. Therefore, to access care in Canada, you need to apply for a healthcare card from your province or territory to prove that you are registered. And for the United States, there are 3 main funding sources for healthcare in the United States: the government, private health insurance, and individuals. The federal government provides funding for the National Medicare program for adults ages 65 and older, and some people with disabilities, as well as for various programs for veterans and low-income people, including Medicaid and the Children's Health Insurance Program. States manage and pays for aspect of local coverage and the safety net. The private health insurance is the primary health coverage for 2/3 of Americans. That is, majority of private insurance is employer sponsored, and a smaller share is purchased by individuals from a for-profit and non-profit carriers. The individuals are the ones who provide healthcare for themselves, which is usually out of pocket, and out of pocket spendings represented approximately 1/3 of this, or 10% of total health expenditures.
Hello, my name is Gurkam Aksu. I'm going to be talking about how payments are made in the Canadian healthcare system. So Canada's healthcare providers have a few ways of receiving payment for their services. Private practices get paid through fee-for-service, where services are itemized and patients pay a fee for the services rendered. Providers in public or community clinics may be paid through salaries or a blended system, such as a mix of salaries, fee-for-service, and incentives. Nurses and other healthcare professionals are usually paid salaries that get negotiated between their employers and their unions. Dental care, vision care, and prescription drug costs are paid for privately, but are only 3% of all Canadian healthcare expenditures. The rest of healthcare costs are paid for by the Canadian government. In fact, 11.7% of Canada's GDP goes towards healthcare costs. This is what allows for Canada to provide such vast healthcare coverage to all their citizens and eligible residents. The Canadian government provides healthcare, universal healthcare to their citizens through taxes from federal, provincial, and territorial taxes. All of this is done through the Canadian Healthcare Act of 1984. Since then, the Act has gone through several reforms to provide structural changes to the healthcare system to ensure a more universal coverage. In the US, healthcare providers are paid through mainly fee-for-service when patients are privately paying for their healthcare, or negotiated fees when they're covered by insurance. The latter makes up roughly 32% of healthcare costs in the US, and then the remainder is usually paid out through Medicaid or Medicare, which is also through contractually agreed on fees.
Hello, my name is Erica, and I'm gonna go over who has access to care. For Canada, it is a universal healthcare system, which means that Canadian citizens and permanent residents are allowed to obtain public health insurance. The following coverage may not be covered through the government healthcare system, depending on the territory where the beneficiary is located. Prescription drugs, mental health care, vision care, dental care, medical equipment, or hospice care. A lot of times, Canadians do select a secondary insurance to be able to pay this addition of care. In United States, 67.2% of US residents receive healthcare through private voluntary health insurance. Public programs like Medicare, Medicaid, and military coverage cover about 37% of US residents. An estimate of 67% of US residents receive access to care through voluntary insurance. And an estimated of 10% of US population is uninsured. When we talk about the differences in access to basic versus specialized care, in Canada, if a patient is looking for a basic care, like a PCP, the patient may need to wait 6 months due to the primary doctor shortage. The average wait time between seeing the specialist and receiving treatment is 11 weeks. Neurosurgery wait time in Canada can be more than a month. Cataract surgery is more than 2 months. Hip and knee replacements can take up to 3 months. In United States, depending on the type of coverage, US residents can wait for a PCP appointment an average of 1 week to 30 days waiting period. An example of waiting time for specialty care are 11 days for an orthopedic surgeon, 21 days for a cardiologist.
So in conclusion, Canada's healthcare system is generally considered one that is universal. This means that 100% of its citizens and residents are eligible for coverage, but they are not required to apply for healthcare coverage, and they're not penalized for not doing so. That means that the healthcare system is not compulsory. The way the healthcare system works in Canada is that the federal taxes pay for the services rendered through the Canadian Health Act, and they are paid through fixed salaries in publicly funded settings and fee-for-service or negotiated fees in private settings. All of Canada's citizens and permanent residents have access to healthcare, with the exception of the following at times: prescription drugs, mental health care, vision care, dental care, home care, midwifery services, medical equipment, and hospice care. Despite the vast healthcare coverage that Canada provides for its citizens, there are waiting periods that come with certain specialized care and services that are not always readily accessible when needed. All of this contributes to Canada's high insured rate and low healthcare disparities throughout the country. And that is all.
These are our references, and that is for group 1. Thank you.